Thank you very much, Chairman Alexander. And I do want to start by expressing my appreciation for your leadership in holding these hearings. It is refreshing to have an opportunity for frank and bipartisan discussions on the healthcare system, and consistent, as you said, with longstanding tradition of working across the aisle on this committee. So thank you very much. I'm also very grateful to each of the insurance commissioners who've come a long way to join us today. Your perspective is incredibly valuable in this discussion. I'm looking forward to hearing from each of you. And I particularly want to acknowledge Commissioner Mike Kreidler, who came all the way from Washington State today. Good to have you here as well. We're beginning these conversations at an important moment for patients and families. There's a lot of work that needs to be done to undo the damage this administration has caused within the healthcare system, because this administration is still trying to create Trump care by sabotage. Our healthcare system is more stable than President Trump's tweets would have you believe, but it is weaker as a direct result of some steps that have been taken. Unfortunately, the President has undermined outreach and consumer assistance efforts and put forward executive orders seemingly designed to inject uncertainty into the markets. Just last week, this administration cut funding for outreach by 90% and funding for consumer assistance by over 40%. And another pressing example is the threats to cut off payments to reduce coverage costs for low-income people. Should these out-of-pocket cost reductions be discontinued, independent analysis suggests that premiums could be an average of 20% higher next year for the most popular plans on the exchanges. There will be even more uncertainty in the markets, and patients and families likely will have fewer options when they go to pick their plans. That is unacceptable, and it is avoidable. Congress can act right away to confirm once and for all that out-of-pocket reductions will continue, and we will have a very narrow window to do that, as the chairman said, before insurances finalize their plans for 2018 later this month. I am very glad that there are members on both sides of the aisle who agree that we do need to take this step, and I believe it is critical we work towards a multi-year solution in order to provide the kind of certainty that will have the most impact on families' premiums and choices in the marketplace. It takes plans months to develop their rates. If we don't find a multi-year solution, we're just going to be back in this room trying to patch the same problem a few months from now. And that's simply not what certainty looks like. This kind of discussion around strengthening our healthcare system is exactly what Democrats have hoped for over the last few years. We put forward a number of ideas that would help stabilize markets and lower costs in the near term. And as I said before, as we work together, I'm more than ready to consider additional ideas from the other side of the aisle to make our healthcare system work better for our families and for patients. But to be clear, that means moving forward, not backward, on affordability, on coverage, and quality of care. Families have rejected the damaging approach taken in Trump care, which would have raised families' costs and gutted critical protections like those for pre-existing conditions, and Congress should listen. I think we're all aware threading this needle will not be easy, but I do believe an agreement that protects patients and families from higher costs and uncertainty and maintains the guardrails in our current healthcare system is possible. This kind of agreement would not only make a real difference for the patients and families that we serve, but it could provide a bipartisan foundation for future work. I've said many times before, this work didn't end when the Affordable Care Act passed. It's certainly true today. There's much more we need to do to strengthen the healthcare system, to lower costs, to expand coverage, and improve quality of care. And these are the issues we should be able to work together on in a bipartisan way. I hope with today's conversation we continue to turn the page away from Trump care and partisanship that we've seen way too much of, and instead start working on health care policies to help our patients and families afford the care that they need, because that is the goal that we should all be focused on. I'm so glad we've seen interest on both sides of the aisle for coming together and working to find common ground on these issues. And I want to again thank all of the commissioners and all of our colleagues who are joining us today, and turn it back over again to Chairman Alexander.